All right, everybody. Thank you so much for joining me today. This is the 2021 Silver Access Virtual Orientation. I appreciate everyone for taking the time out to come and listen to me speak. So we're going to go ahead and get started. Okay, just the content outline. We're going to go ahead and start with an introduction of myself. Second, we're going to do a review of some of the key terms from previous orientations. Third, we will talk about the topic of the American Rescue Plan. Fourth, we'll talk about the COVID vaccine, and then we'll have a very brief Silver Access flash review, followed by a Q&A at the end. So if you have any questions, feel free to leave your questions in the chat box. I'm going to ask you, this is going to be an interactive orientation today, so I am going to ask you to maybe participate in the chat box. As long as you can just do that, it's fine. And then if you have any questions, put that in the chat box as well, and we'll get to them at the end. All right, so just an introduction of myself. My name is Marina Sidori. I am the Silver Access Program Coordinator. For those of you that may not have met me before, it's very nice to meet you. I wish I could meet everybody in person. I really did enjoy doing orientations in person because it was so nice to put a name to everyone's, to put a face to everyone's name. I mean, I talked to everybody over the phone or via email, so it was nice to meet everybody, but hopefully one day we get back to be able to do that again. Just a little bit of background about myself and the Silver Access Program. I started with the DuPage Health Coalition as an intern in college. And when I interned, my boss, Kara Murphy, had the idea of Silver Access, but there was no program that had been launched yet. So throughout my internship, I did a lot of data analysis and research. And with the help of Kara Murphy, we collaborated together, and we were able to present this idea to the CEOs and the CFOs of all the DuPage County hospitals. At the end of my internship with them, we actually landed the funding to launch this program. And since 2015, 2016, Silver Access has been here and helping everybody in DuPage County that qualifies. So just a little bit of history about myself and the Silver Access Program. Okay, this is going to be the first time I'm asking you to interact with the chat box. These are the key terms. We did talk about them in last year's orientation. If anybody remembers these terms, please, in the chat box, put how many of these terms you know the definitions to, whether it's 1, 2, all 5 of them. Just type in your number. I just want to know, how many people remember them. Wow, we have all 5. Awesome. And some of them are abbreviated. So if you know them and their abbreviations, you are awesome. Okay, great. All right, I'm going to go ahead. The next slide we have is going to be their definitions. We're going to go and review them. So a premium, this is a very important term that we should always remember. Your monthly premium is the amount of your health insurance that you have to pay for every month. This is the amount that Silver Access is helping you pay. So as you are enrolled in the Silver Access program, I pray that you are not making your payment, your monthly premium payment directly to your insurance company. If you are, don't do it anymore. Let us help you. That's why we're here. Second term was abbreviated as APTC, and we're actually going to talk about this a lot this orientation. So take notes if you need to remember what an APTC is, your advanced premium tax credits. Everybody that's enrolled in a marketplace plan I won't say everybody, but almost everybody is awarded advanced premium tax credits. And what they are is they help lower your monthly premium payments on health coverage purchased through the marketplace. Advanced premium payments of tax credit can be used right away to lower your monthly premium costs. So as you may know, the cost that you're paying for your health insurance right now is not the real cost of it. A lot of these health insurance plans have a very pricey monthly price tag to them. So what your APTCs do is drop that cost down dramatically. And your advanced premium tax credits are tax credits that are given to you in advance to lower your premiums. So that's where they get APTC, advanced premium tax credits, from. The third term is your deductible. This is a super important term to be aware of. Your deductible is the fixed amount of money that you are responsible for paying before your health insurance begins to kick in. After you've met your deductible, your insurance will then start to pay for a portion of the cost. So let's say your deductible is $1,000 for the year. Before your deductible kicks in, or before you've met your deductible, you're going to be paying 100% of all the medical costs until you've hit that $1,000 limit. After you paid $1,000 and your deductible is met, then most of the health insurance plans offered on the marketplace have a 70-30. Some of them have a 80-20 ratio, where once you've met your deductible, then your insurance will pick up that 70% of the bill or that 80% of the bill, and you'll be left with either 20% if you have a 80%, 80-20, or be left with the 30% if you have a 70-30. And again, if you have any questions about these terms, just leave me a message in the chat box. Special enrollment period. I had this one abbreviated as SEP on the previous slide. So your special enrollment period is a time when you can sign up for health insurance. You can enroll in marketplace coverage through August 15th right now. Right now we are in a special enrollment period because they reopened the marketplace until August 15th. So right now everybody is in a special enrollment period. You may qualify for special enrollment periods outside of open enrollment time if you have one of the qualifying life events. So that includes losing health coverage, moving, mostly if you move to a different zip code, or more importantly, obviously, to a different state, because there's going to be different plans offered in different zip codes, or counties. I'm sorry, I should say counties, because it's not really the zip codes. It's like DuPage County versus Cook County has different plans available. So if you were to move out of DuPage County, you would then enter into a special enrollment period, because it's possible that your plan that was offered in DuPage County is not available in Cook County. Getting married, having a baby, or adopting a child are also qualifying life events for a special enrollment period. Lastly, your maximum out of pocket. This kind of goes hand in hand with your deductible. They're fairly similar, except your maximum out of pocket is the most you will pay for your health insurance care for the entire year. So once you have met your deductible, then your insurance begins to kick in at a certain percentage, whether it's 80% or 70%. But once you've hit your maximum out of pocket, your insurance will then kick in at 100%, because you're capped out. There's nothing more that you should be paying for. It includes your co-pays, your deductibles, and your co-insurances that you pay. So all of those go into the piggy bank that's called your maximum out of pocket. Once you hit that max, your insurance covers you at 100%. Okay, so pause for a second here, because this Zoom session is actually being recorded so that I can post it online for people to take, to be able to come and listen to this on their free time instead of on a Zoom. So I am going to throw in one of my trick questions that I am going to put into the quiz. So if you took the quiz last year, like because we didn't do Zoom last year was just all online. So if you remember, I put in a question just to make sure that people are actually listening to the video, what the color of my car is. So last year, my color of my car was black, and I got a new car this year. I love it. I got a new little SUV, and this new color of my car is white. So that is going to be one of the questions in the quiz. So I just had to throw that in there. All right, now we'll continue. Let me check the chat box for any questions. No questions. All right. Okay, so you're the American Rescue Plan Act. Drop a 1 in the chat box if you know what the American Rescue Plan Act is. I'm curious to know how many people know what this is by that name. I know the name throws a lot of people off because not a lot of people know what that means. But if you know of this, or if you heard of this, I want to know if you guys have. Okay. All right, so not a lot of people have heard about this. Okay, so this is going to be important, so listen up. So the American Rescue Plan Act, this is what the bill that was passed by President Biden that allowed for the most recent stimulus package to go out. But it didn't just include that stimulus package, it included a bunch of different relief funds for other things. So one of them was additional funding to lower the cost of medical insurance. So right now we have new lower costs on the marketplace for coverage. You may be able to get more savings and lower costs on your marketplace health insurance coverage due to the American Rescue Plan Act of 2021. Under the new law, more people than ever, I apologize, before qualify for paying for health coverage, even those who weren't eligible in the past. Most people currently enrolled in a marketplace plan may qualify for more tax credits. Insurance premiums after these new savings will go down dramatically. So that is just the tip of what this American Rescue Plan Act is. We're going to dig more into what the provisions and what this plan actually includes and what the changes are for this year. So your advanced premium tax credits will be higher for nearly everybody. That goes for this year, 2021, and next year, 2022. So we will see instead of hopefully, every year your insurance seems to be going up. Hopefully next year we see it either decrease again, hopefully, crossing our fingers, or about the same as with these new higher tax credits. Secondly, people with income between 100% and 150% of FPL will be eligible for a zero premium plan. So if your income falls in that category, you may see your premium drop all the way down to zero. That doesn't mean that you're losing your health insurance, just means that they're giving you enough tax credits that it zeroes out what you owe. People whose income were over 400% of FPL, they used to not qualify for any tax credits. At that point, they just had to pay full price with no help of their health insurance plan. Now, with this Rescue Plan Act, they are eligible for advanced premium tax credits, and that is for 2021 and for year 2022. Fourth, people who receive unemployment benefits will be eligible for a zero premium benchmark plan. So I know a lot of people who've been impacted by COVID are on unemployment benefits right now. Excuse me. As of July, sorry. So people who are currently on unemployment benefits, as of July, your premium will go down to zero. We do recommend, sorry, I'm getting over an ugly cough. We do recommend that you update your income if you are on unemployment on your marketplace profile, that you're collecting unemployment so that they know. We'll be seeing that transition happen in July, so that's to come in the near future. Advanced premium tax payment repayment will be forgiven for only the year 2020 taxes. This happens when people may not have reported their factual income to the marketplace, in which they could have possibly been given more tax credits than they should have. In that circumstances, when you reconcile those tax credits, they're going to be like, hey, you said you only made 20,000, and really your taxes say you made 40. So you need to pay us back those tax credits that we gave you, because that's not fair. Well, with this Plan Act, they are going to wipe away anybody who will be penalized for that. So that's only for year 2020. So going into this next year, let's make sure our incomes are reported as accurate as possible. Premiums will decrease on an average of $50 per person per month. So that's about accurate. I'm seeing anywhere between $50 to $100 difference between before and after you go into the marketplace to accept these higher tax credits. Existing enrollees must return to their marketplace application to accept these new advanced premium tax credits. If you don't go in and accept them, your premium will not drop. So I'm working on trying to get everybody in with either with me or to do it themselves to go back into the marketplace. And I'm going to walk you through that process in the next couple of slides so you can see how easy it is to be able to drop your tax credits within under 10 minutes. New enrollees can enroll before August 15th. So anybody that does not have a marketplace plan right now, they can go into the marketplace, and while we're in an open enrollment period through August 15th, they will see the immediate upfront savings. So they'll immediately get to take advantage of the more tax credits. All right, so as I said, how do I accept these new tax credits? I'm going to walk you through step by step on how easy it is to go back into your profile and accept these tax credits. So one second. All right, so if you need help with this, please send me an email. Please give me a call. I can, it's literally as easy as a 10-minute Zoom session with you. And I just need your permission. I need you to sign a consent form. And we can do this in 10 minutes and I walk you through, you'll see my screen and watch me, plug everything in and get you your new tax credits. But if you feel like doing this at home, absolutely possible for you to do this yourself as well. All you have to do is head over to healthcare.gov and log in using your username and password. Once you are in your profile, you're going to want to scroll down and click on your 2021 application. It should say status complete. Everybody should be in a complete status. If you're not, call me and tell me. Okay, after you do that, on this toolbar is going to be on the left-hand side of your screen. You're going to click on report a life change. Once you've clicked that, this box will pop up and you're going to click report a change in household income size, address, or other information. Even if we're not changing anything, this is just the way to get back into your application. Even if you're not changing anything, this is the way you have to do it. So after you click that, it's going to pull up your entire application again, and you're going to go from beginning to end. The lovely thing about that is that everything is already filled in still. So it's not like you have to walk through your whole application again. There might be 2, 3, maybe 4 questions that you might just have to click a button for, but everything is already pre-populated. So that's why it takes less than 10 minutes to get through everything. Once you get through the end, this screen will pop up and it will tell you right here what your new tax credits are. What you have to do is click and download this eligibility notice so that the PDF downloads and then you can open it. Once you've downloaded that PDF file, then the next button below that will pop up. It will turn green so that you can click it because before you download the PDF file, it'll be gray, so it won't let you click it. So you have to download the PDF file, then you can continue on to enrollment. Now, if you like your plan, you like the insurance that you have right now, you do not wish to change, this is super simple. You're going to, the first plan that you see pop up is going to be the plan that you're enrolled in. So all you have to do is click the green enroll button, and that's going to be your way to accept this new premium. So right here, you'll see what your new premium is going to be. Make sure you take note just so that you know like what your new premium is and you can compare the difference. Okay, so after you enrolled in your plan, whether you change it or you keep it the same, if you've kept your plan the same, Silver Access will be updated by your insurance company when I do your monthly verification on your account of your new premium. If you choose that you would like to switch plans or switch to a different insurance company, you will be responsible for paying your first month premium again. And the reason for that is because I will not be able to make a payment for you until you've been assigned your member ID. And most insurance companies won't assign you a member ID until you've paid that first month premium. So there's no way for me to go in and find you and verify your information until you're in that system, which means if you do decide to change plans or decide to switch to a different insurance company, you are responsible for paying that first month. So in order so that they can send you your new insurance card. And then once you get your new insurance card, snap a picture of it, attach it to an email and send it to me. And that way I will be able to verify that and, you know, get it sent over to the other insurance company. And then, the following month is when we will take over. But to reiterate again, if you keep your plan the same, you do not need to make your first month premium, okay? Okay, transition of topic. We're gonna start talking about the COVID-19 vaccine. So I know this is everywhere. You hear it on the news, you hear it on the radio station, you hear it on Pandora, like it's everywhere right now. And it's because it's so important. We're in the middle of a pandemic and everybody is just ready to get back to life as it was before. So we're just gonna, you know, talk a little bit about it. All right, so some key facts about COVID-19 and the vaccination. Getting vaccinated can help prevent getting sick with COVID-19. People who have already gotten sick with COVID-19 they will still benefit from being vaccinated because you can catch it again. COVID-19 vaccines cannot give you COVID-19. So therefore, when you get your COVID-19 vaccine, it will not cause you to test positive on a COVID-19 test. Okay, the efficiency of the two most popular vaccines, you got Pfizer, and their efficiency rate is a 95%, and Moderna is a 94% efficiency rate. All right, so when the vaccine first rolled out, they released it in different phases. So back in December, when it first started rolling out, it was only available to people of healthcare personnel, people that worked in the hospitals, the doctors, people that have face-to-face contact with COVID-19 on a daily basis. And then February through April, we entered into phase 1B, where this was frontline essential workers and those over the age of 65. So this was our grocery store workers, our janitors, our bus drivers, you know, people that kept working through the stay-at-home phase. And 1C was everybody aged 16 through 64 with medical conditions that increase the risk of COVID-19 and other essential workers. Right now we are in phase 2, which is pretty much everybody is available. I think they recently even opened up that 12-year-olds can begin to accept to get the vaccine. So, you know, it's pretty much the rest of the population at this point. So if you want to get your vaccine, you absolutely can. Where can you get your vaccines? This is information from the DuPage County Health Department. So you have mass vac sites, you have temporary community vaccination sites, your federally qualified health centers, so Access Community Health, Hamdard, Greater Elgin Family. Those are all great spots to go and get vaccinated. Of course, you have your pharmacies, Walgreens, Meijer, Walmart, Target, Sam's Club. You can go there and schedule an appointment to receive your vaccine, or your medical provider, your family medicine, your internal medicine physicians. Right now, the DuPage County Health Department is accepting walk-ins for their community vaccine clinics. So right now, walk-in hours are 8:30 through 2:30 p.m. Monday through Friday, and 8:30 a.m. through 12:30 p.m. on Saturdays. They do wish that you register beforehand, but if you don't, you can register on site. Okay, so that actually, we're going to get into the flash review of Silver Access. So if you are a new member and you need this in further detail, give me a call, we can review this. But for everyone, this is just a review. So as you know, there are 4 requirements in order for your membership to continue on for Silver Access. First, everybody has to pay the first month premium directly to your insurance company. So everybody always pays January's premium. Silver Access never pays January's premium. Second, everybody is responsible for to submit the member responsibility acknowledgement form. This is a part of your approval packet. So if you haven't received that, or you don't remember signing it, I did it electronically this year, just let me know. Number 3, everyone has to set up a monthly payment plan or pay off their Silver Access outstanding balance if you have one. Not everybody does, most people do. And then lastly, you have to attend one of these lovely orientation sessions with me. Monthly payment plans. We accept payments in the mail, checks. We accept auto electronic payments, so people can get on an auto payment plan with us. And we accept one-time payments. Everything is either online or in the mail this year. We are not accepting any cash payments in the office. Our office is not even open still. So we don't accept payments in the office. Most importantly, when it's time to re-enroll, please everybody remember this, that you do not, your Silver Access enrollment does not roll over for next year. You have to submit a new application every single year. And the Silver Access application is not your Marketplace application. It's completely separate. There's 2 steps. Step 1, do your Marketplace application. Then step 2, do a new Silver Access application. If your account is delinquent, so if you didn't meet all 4 requirements, you didn't sign that MRA form, you stopped paying your payment plan or never set one up, or you did not attend an orientation, you will not be eligible to return back to Silver Access next year. Okay, we're gonna open up for Q&A. So the chat box is open. If you have any questions, please leave me any questions in the chat box so that I can answer them. If you forget, or maybe something comes to you tonight when you're laying in bed, send me an email and I will absolutely respond back to you and answer any questions for you. The orientation is set up so that everybody has a clear understanding of what the Silver Access program is, how I can help them. One topic that I did forget to mention is I understand that everyone's premiums are going to be changing, which means your Silver Access balance may be changing. I am currently in the middle of working on getting everybody's invoices together. I should have those out to you by mid-June. If you're on an automatic payment plan, I will automatically adjust your monthly payments based on your lower new premium. So there's not much that you need to do, but just pay attention, keep an eye out for those invoices that are coming out. And if you're not on a payment plan or you haven't set one up, please set one up soon, because you won't be eligible to come back next year. And I hate turning away people for that reason. I'm so open and flexible with helping people, especially when it comes down to finances, guys. Like, all you have to do is just let me know. Like, hardships are everywhere right now. People are struggling. The struggle is real. I understand. And if I can help, I will. But closed mouth doesn't get fed. And if I don't know the situation, I have to follow the rules, and I won't be able to let you come back. The recording will be posted online, so it will be on our website, as well as the quiz. So I will have that up by the first week of June. So hopefully after this weekend, I'll have my website expert be able to post this new video on our website for us. We are still accepting applications for Silver Access, so we are not turning away anybody. If you have somebody that has a Marketplace insurance that needs help, go ahead and have them apply on our website. You're welcome. Are there any more questions? All right. Okay, well, I want to thank everybody one more time. Thank you so much for taking the time out of your night to just listen to this orientation. Noemi, we sent out the approval packets electronically this year, so it might be in an email. I can send you a new copy of it. Just send me an email to request that, so I might forget. Thank you guys so much. Again, follow up with me with any emails or give me a call tomorrow. And I will get anything answered. So I will go ahead and end it here. Thank you guys so much and have a good night. Bye-bye.